Conrad and Vince Hvizda. Gentlemen, please take it away.
Rick, thanks. I appreciate it. Dave Conrad with Roundstone. I've been there for more than 12 years. We've been helping employers in the Cleveland area for a little bit longer than that. We are a captive manager and an underwriter for health insurance. We work in all 50 states, and we have, almost 100,000 different plan members that are engaged in our platform in one way or another. Appreciate the opportunity to talk about the program today. And Vince?
Yeah, I'm Vince Hvizda, CEO of Admiral Products. I've owned this company since 1986. We're in the printing business. We call ourselves printers for the packaging industry. Specifically, we focus on the aerosol and chemical packaging industry in terms of printing labels that go around their various containers. We can do other kinds as well besides just our core business, I should say, is the packaging industry, but we can do other things as well. We've got approximately 25 people that work here. We ship all over the country, and we were the ones back in 1988 that pioneered that glossy look that you get on various magazines and things that are fairly common today in the marketplace. It's a UV coating is what it is. We trademarked it, called it Admir, and that's our claim to fame, so to speak, in terms of protecting the label that goes around chemical cans and aerosol cans, as well as any other kind of commercial printing that we can do. But again, we focus on the packaging industry. So that's the quick background we have here. We only have one plant. We're located here on West 150th. We started back on West 105th Street in 1987, and we moved here in 1997, and we're in a building that's about 39,000 square feet, 29,000 production, and the other 10 warehouse space. So that's kind of a thumbnail description of what we're about. And Dave, I don't know what else you'd like me to offer in that regard.
I think that's good. So Rick, you have some questions for us, or do you just want us to kind of tell you what we do, how we do it, our experiences? You tell us, Rick.
Yeah, I'd say let's start out by maybe telling a little bit about the program itself. Okay. And then maybe have Vince then speak about his experiences when using the program and how it's affected his business.
Okay. All right. So Roundstone itself, I'll give you a little bit deeper dive. I'll kind of give you a 30,000 foot view, kind of like those ospreys that were flying around last week. I think everybody on the west side saw them. But I'll tell you a little bit about that. I'll tell you what we do with middle market employers, middle market manufacturers around the country and locally. And Vince also wanted me to, before I hand it off to him, was to talk about his experiences. He wanted to give you some pros and cons. Just don't paint the rosy picture. Also say, what might be some of the downsides of this program. So let me just start off. Again, privately held in Cleveland, and we're independent. Now, and I'll tell you why that means a lot a little bit later on. But what we do is we help middle market employers, manufacturers save on their health care, either flatline it or contain their costs year after year. The way we do that is we take them self-funded. We build a customized plan for them. And we look at the data throughout the year and at renewal, and we sit down with their advisor, their broker, their Oswald, who's on the phone, and we sit down with them. We say, here's the cost drivers, and here's a solution. Here's the return on investment for that solution. And then we also hold your hand while we implement that cost containment solution. So most of you on the phone are probably fully insured today, and you don't have access to data. You don't have access to what your cost drivers are. You have zero transparency on anything that's going on your plan. And you have no control. You basically have to take what the Anthems, the medical mutuals, the Aetnas, the Uniteds show up every year and just take what they give you. Our our program, a middle market employer, someone with as few as, 5 on the plan, but average client usually has about 50. But some of the few is 20, many is 1,000 on the plan. They get access to their data. They get access to cost containment levers they can pull, and they level their healthcare. At Roundstone, what we're trying to do is help you with healthcare like Fortune 500. I mean, if you think that a Sherwin-Williams, a Progressive, a Parker Hannifin, American Greetings, you name it, you think MO or Anthem or Aetna walks in there and goes, hey, there's a 20% increase this year, and if you play nice, you don't bid this out, we'll knock it down to a 12. I mean, that's not how it works for the large corporations. And so what we're trying to do is get manufacturers, small to middle market manufacturers, the ability to purchase healthcare like a Fortune 500. We're going to say, here's some different things that you can do. You can change your plan designs. You can, buy your pharmacy in a different fashion. You can, leave the network behind and enter into a direct contract with the hospital. There's all different solutions. There's all different unique ways that you can contain costs, but you have to be funded to do it. So what I'm getting at is what we're trying to do is at the end of the day, get you to purchase your healthcare like a Fortune 500, and that is an annual increase of inflation, not medical inflation, which is 8 to 12%, but inflation, which is 3 to 4%. And that's what our employers across the country and locally have seen that have stayed with us. And Vince will talk about his story in a minute, but that's where we get you, okay? And that's the end game for us at Roundstone. So the pros and the cons, and I'll kind of finish with that. So the pros of this program are kind of what I mentioned. You have access to data, all your claims data, all your financial, who gets paid for what. You have a very high variable cost plan, meaning if you don't spend the money, if the plan doesn't spend the money, you get the money back, and you have total control over your plan. So those are the pros. All right, what's the con with that? Well, the con would be you now have to engage your plan members, your employees, to use the plan efficiently. And so you work with your advisor and you educate your employees to utilize the plan efficiently. You educate your employees to make the best decision for the plan, to find the highest quality of care. It's not always going down the street to the Cleveland Clinic for everything. There could be a center of excellence that does great work, and it's going to be higher quality return for your employees and the plan members, and we'll offer you those solutions. So, you have to be more engaged in your healthcare plan. It's not just an annual. The broker shows up, you pick from a spreadsheet and go, I want this one because it has the lowest increase. There's more involvement with your advisor on an ongoing basis. How's my plan doing? What are the cost drivers, and how can I contain those costs? So that would be a con. Another pro would be, like I mentioned, you're going to save money. Folks on the call, manufacturers on this call, you're probably between 5 employees to 500 on the plan. Well, those employers, 5 out of 6 years, you're going to have a really good year where an underwriter will say, expect to spend $1, and you'll spend less than $1. You'll spend, 80 cents or 70 cents or 97 cents, but you're going to save money. What's the con? The con is 1 out of every 6 years, 1 out of every 5 years, depending on your size, you are going to spend a little bit more than the expected cost or the projected cost. So I can guarantee in those 4 or 5 years, you're going to save a lot more than in that 1 year where you spend a little bit extra. But again, that's the con. There's a hair of volatility with this, but we've designed reinsurance and insurance programs where if there's a catastrophic claim, you're protected. If there's a bunch of frequent claims, you're protected. In any given month, if there's a lot of claims, you can buy insurance to protect you from the cash flow volatility. So again, at the end of the day, the pros are you have access to your data, you have total control over your plan, and you're going to save money. And, you know, what we hear from our employers, you know, that move with us for a long time, and Vince could probably attest to this, and he will in a second, you know, the savings that you see compared to being fully insured, about 1 every 5 years, if you add up those savings, you're going to get, it's like a free year. It's like, you know, if I took all my savings, 100,000 from each year, the 5th year I saved, you know, the total $500,000, it's a free year. So that is the pros versus the cons. And at the end of the day, everybody on this phone is a manufacturer. And if the machine, if Vince's shop, if a printing press isn't working or it's making a funny noise, Vince or his chief operating officer or his maintenance guy is out there going, why is that machine not working efficiently? You know, what can we do to fix it? That's all we're doing with your healthcare plan, guys, is we're finding out what the cost drivers are. Why isn't your plan operating efficiently? And we're pulling a lever and we're fixing it so your plan runs smooth. That's all we're doing at the end of the day, is we're fixing a pretty big number. You know, you got payroll and you got healthcare. Right behind payroll is your healthcare cost. So this is a big number. And so that machine needs to run efficiently. That lathe needs to run efficiently. And so being self-funded, we give you levers to pull. We give you cost containment vendors that you can access that can help you run your plan efficiently. So a little bit long-winded, Rick, but that's kind of what we do.
No, that's great, Dave. Thank you very much. And Vince, I do have a question for you. I understand that you're a native Clevelander with decades of experience in the manufacturing sector. Can you tell us what prompted you to make the shift from a fully insured plan to a self-funded plan, and what was the journey like?
Well, to begin with, the cost of healthcare probably is either the second or third most expensive cost. Looking at that every year, with the cost in the early stages back in the 80s and let's see, late 80s and the 90s, you know, we were getting increases 5, 8, 10%, but they kept going up every year. Well, in I think it was 2012 or 2013, Aetna came to us and said, here's your increase this year. And by the way, it's 35%. And I said, something has to happen here, okay? Because there has to be an alternative to what we're doing right now. Now, I take that position based on the fact that I think it's covered. Excuse me, I want them to have insurance coverage, healthcare insurance coverage, because God forbid if something major happens to them, boy, it could financially ruin them, okay? So if, you know, I subscribe to that philosophy and I said, okay, our program is set up based on the fact that the company picks up 75% of the premiums. We asked our employees to pick up the 25%. Now at 35% increase, I said, golly, how am I gonna, over the years, I should say, let me back up a little bit. Over the years, with the increases coming to us, wanting to keep that 75, 25% a partnership, if you, what we tried to do was, well, you know, how do we keep that? And so what we did over the years was, let's see, the increase came to us, well, maybe we can increase our deductibles, and that keeps the premiums down. And then it just got to a point where all of a sudden maybe we have to start, you know, gutting the program in terms of just what's available. But the 35% increase really rang the bell with me. So we started to look around and say, is there another alternative? Well, along came the self-insurance program. And basically in a nutshell, I think Dave touched on a lot of it, but in a nutshell, it's what it gets down to is it's a question of risk, okay? When you're fully insured, basically what it gets down to is that risk totally is borne by the insurance company, okay? When you're self-insured, effectively you take on a portion of that risk. The beauty of that, of taking that on, however, is that it isn't an all or nothing situation. And by that, I mean, you can sit down and work with a company like Roundstone and say, okay, my risk tolerance is, and you set a dollar figure. Ours, frankly, is $20,000. And what that means is that we pick up all the costs associated with up to $20,000 per employee. Now, what's the downside of taking on that particular risk? Well, the downside is if all 25 of my employees ran up at $20,000, everybody ran up $20,000 in a year, we would be responsible from a cash flow standpoint to the tune of $500,000. That would not only get our attention, but I think maybe would bring this company to its knees. Okay. Now, kind of looking at that, I view these situations in terms of what's the worst that can happen to us. Can 25 people all run up $20,000? The possibility is there. The probability is not. I don't think that's going to happen. So we ended up setting the limit at 20,000. Went with the program. Okay, 3 months, 3 or 4 months into the program, one employee had a heart problem. Well, she went through 20 grand, up through 20,000 in a heartbeat. Then I started thinking, oh my God, what did I do? But that was 1 out of 25. That was a little burp in the road, so to say, or bump in the road. It didn't bring us to our knees. It's something that happens, and we absorbed it, and everything was fine. So that's the negative side of it. But the positive, again, gets down to that risk tolerance that a company has. And the other thing, too, is that particular figure is negotiable, depending on, your circumstances financially and just what your risk tolerance is. And it's all looking at the numbers. So it's not etched in stone. Okay. The other part of the program is that such that, it's a year-by-year program for us. We got into it. And if there's something that we didn't think of that, comes out and left us, there's always that possibility that we could say after a year, we want to go back to a fully insured program. All these years that hasn't happened, okay? And it hasn't happened because every year there's a comparison made between what the fully insured cost would be versus what our expenses were, and we've saved money, every year in the process of doing that. The other thing that's a big positive of this program, and that is there's a difference between premiums that we pay as not only as individual companies, but as part of a captive. All that money goes to premiums. Conversely, the insurance company pays out the expenses from those premiums. If between the premiums they collect and the money that is paid out, if there's a surplus, that particular surplus is returned to all the captives, okay? 1 year we received, I think it was the first couple years that we were in the program, we got back a check for, I think the first one was for about $11,000, okay? Now that doesn't mean it happens every year to that extent, please. I don't want to mislead anybody, because a couple years later, depending on the performance of not only us as an individual company, but of the captives group as a whole, if as a whole, that whole captives group had some issues with some expenses that were higher than anticipated, then you're not going to get back as much, okay? So 1 year, I think we got back about $800 or something like that. Last year, just to show you the ups and downs of this thing, because it is fluid, okay? Last year, we got back $29,000 in terms of the difference between what was paid out in claims by the insurance company and the premiums that were paid into it. That was the surplus. So those are the kinds of things that they're real pluses. And the main plus, in my opinion, and Dave alluded to it, and that is cost. Not only cost, but cost control. You've got some control over what's going on, with your business. Specifically, one of the things that the big companies enjoy, and even, from a fully insured standpoint, aside from deals that they cut for their premiums, but they also have access to a lot of information that we as smaller companies don't have. So when you're self-insured, what happens is I get information on a monthly basis, in fact, on a weekly basis in terms of claims being processed. I know what every employee in this company spends for doctors. I know what they spend for prescriptions, and we get a report once a month based on those totals. And how much was spent by everybody, total dollars, etc. A wealth of information is there, and there's things that you can do with that information. One, it lends itself to being able to set up things like wellness programs, if in fact that's something that you feel that you want your company, if you want to do that. And we've gone down that road to a certain extent. We also have retained there's a concierge service by the name of All Light. I think that is right, isn't it, Dave? Is it All Light is the name of the company? Yeah, concierge service. And what these folks do for us is that they're available. They act, I call them like almost ombudsman, in the sense that they are there, and if an employee has a problem with with the doctor or some medical bill, they can call them, and this All Light service will effectively go to bat for them and try to work out the things for them. They also provide a very valuable service, because by virtue of their position and what their responsibilities are, they can challenge some of the drug costs or make recommendations in particular to employees. For example, if an employee is told he's prescribed to get an MRI, and an MRI, I think in the Cleveland market, I've heard numbers in the neighborhood of, say, $4,000 for an MRI. If that's what they're told, that's what it costs, etc. What they can do is get a hold of this All Light service, and what they will do is effectively search the market in this greater Cleveland area to find out if, in fact, that's the best rate that they can get for an MRI. And it's if anybody watched 60 Minutes, I guess a number of months ago, you can see that they did a survey in nationwide, and found out that even within a given market, you've got variations anywhere from $1,500 to $1,000 to $10,000 in terms of MRIs. So that's just the marketplace and the various costs associated with that particular procedure. So what that means to an employee is that if they can get a recommendation effectively that, or if they have a cost that they've been quoted at $4,000, and somebody, if All Light can find them somebody that will do it for a lot less, then effectively, what does it mean to the employee? Well, it may affect their out-of-pocket expenses. They can save money in that regard. So, and I can go on and on and on. I don't want to, I'm excited about the program. We've been in it for a number of years now. It's worked well for us. And, so what else can I say about it?
Well, no, that's great, Vince. Tell us a little bit about what has the experience been like for your employees?
Well, I think I alluded to some of that by virtue of having them, before I lose the thought, one of the things that I know goes on, my initial reaction would be, well, I think it's good, but there's ways that I can support that particular statement. One being, I get a report from All Light, this company, I think it's either monthly or quarterly, it escapes me. I think it's quarterly. Anyway, tells me it tells me the amount of engagement that the employees, how many people called on, what did they call for, what referrals were made, and all these other kinds of things. And based on the reports that I'm seeing, they're helping our employees. I mean, I haven't heard anything. No one's come into my office and said, listen, I'm having a hard time with with a bill from the clinic or whoever it is, and that hasn't happened. It's been handled by this All Light. And again, from what I'm told and from what I can see, the employees are comfortable with it. One other thing that I think is important, as long as you brought that up, and that is when we made the change, one of the things that I thought was important was that I didn't want to make insurance experts out of the employees. So what I prescribed, or what I actually wanted, was whatever network or whatever plan we had in place as a fully insured company, I also wanted that to be transferred over to a self-insured, company, and that was done. So there weren't great changes. Like, for example, I didn't have to go to the employees and say, listen, excuse me, the doctors that you had before, suddenly this has changed and that's changed. That didn't happen. I wanted to make it as transparent as possible. So it's just a change that management made, and as opposed to some radical upheaval that had to take place, and that did not happen. So that's
great. Now, has there been a significant change in work related to your benefits plan since you made the switch?
I'm sorry, what?
I'm sorry, has there been a significant change in work related to your benefits plan?
A change in what regard, Dave? I guess I would ask.
I'm sorry?
You said, has there been a significant change? In what regard?
Well, in just the work that it takes in order for you to manage the plan versus, being fully insured.
Oh, no, listen, that's the other thing. I'm glad you brought that up. That's the other beauty of this program, as far as I'm concerned, and that is, we didn't have to do anything. I mean, there's an administrator that Roundstone recommended that handles all the, that administers. It's just like having a third-party administrator, which is effectively a form, and that's what they do. So it's all set up. It was all set up with them. They handle all the claims, all the financial transactions that take place. They handle for us, and we get reports based on the claims being paid and the whole 9 yards. So, and we're not big enough to have an HR department or a finance department that handles all that stuff. In fact, if we had to do that, I probably wouldn't have not have made the change, because it's very, those are added expenses that you'd pick up and maybe would be a wash in terms of any savings that you could pick up. There'd be an added cost to us if we had to set up that whole area, which we did not have to do. So that's the other beauty of this kind of program. You can make the switch without worrying about having to add the staff to administer the program.
That's terrific.
Yeah.
And Dave, I have a question for you. Now, I'm told that Roundstone has a team called the Cost Savings Investigators, or CSI, which is a real differentiator for you, as the intent is to provide long-term savings for the captive participants. Can you tell us more specifically what this team does?
Yeah, so, I know the name's cheesy, CSI, right? Cost Savings Investigators, but let's get past the name. They do great work. Basically, it's a team made up of, they're backed by some software, but it's a team made up of data geeks, folks that scrub your data. We have a person on staff, that's all they do. Nurses, RNs, your underwriter, the individual that looks at your plan and your claims and how they're running every year. And then you have a client manager, somebody that works with the third-party administrator, works with your broker advisor. So, it's a team of 4 to 5 different individuals and a software behind it. And so what they do is, throughout the course of the year, if Vince were to have a claim above $10,000, Vince gets an email saying, hey, there's a larger claim coming. And we, as the administrator of the large claims, the catastrophic claims, the insurance company, we get the report too. So there's a trigger that'll go off, or we'll see a trend in their claims where there's, Vince, and again, this doesn't happen to Vince's, but maybe you have an employer where the emergency room visits, like their employees are using the emergency room like a primary care visit. Or you might have something where, the employees are taking brand and private label drugs when generics are available. Or, you might have a manufacturer where there's a lot of knee surgeries or a lot of back surgeries, and they're all walking into Cleveland Clinic and paying full price. And so, again, this team is going to look at this claims data and say, well, here's a trend for a 50-life employer, a 100-life employer in Cleveland, and you're triple that or you're double that. And so what they do is they then go, we have more than 175 cost containment vendors that are independent like us. And what we do is we go out to those vendors and we share the data, and then come back to us with a proposal. And then we take that and put numbers to it. So what would happen is, let's say, for instance, that Vince, his company, and again, I'm just throwing this out there. Let's pretend Vince's company, Admiral Products, his employees are all taking brand name drugs when generics are available. So what we would do is we go, hey, Vince, if you make generics free, or Vince, if you switch your pharmacy from CVS or Express Scripts to Southern Scripts, you will save, 33.2% on your pharmacy spend. So again, you got folks that are monitoring your claims, looking for trends, looking for, bumps in the road, as Vince said before. They then work with some vendors to get some proposals. They sit down with your advisor, and your advisor sits down with Vince and says, here is what the problem is, here is what the solution is, here is the return on investment. Do you want to engage in it? So, you know, before I was on a call earlier today with an advisor out of Pennsylvania, and there's a renewal coming up for an 80 life group, and the advisor's in PA, but the group's located in Cleveland, and they're not a manufacturer. But the advisor said to me, because we made a recommendation at the renewal, we said, you can keep your current pharmacy, but if we overlay this solution, and the employees don't know the difference, nobody will know the difference, but if you put this pharmacy consulting solution on there, you can save 35%. And this advisor, who works as a very large advisory brokerage shop, said, how did you get me access, you know, for this little 80 life group? How are you giving me access to this consultant that works with 2 million clients? And we're like, that's the beauty of the captive. That's the beauty of the CSI team. That's the beauty, because what we're doing, Rick, is we have, you know, like I said in the beginning, 100,000 lives, right? And so we're leveraging those 100,000 lives. We're making Vince's company not making them, but they have access to the market and vendors that they wouldn't have access to otherwise. But because of our pooling and our large pool of employers that are engaged in cost containment, we can do this. So again, it's great results for our clients. And the more that we can save Vince, the more, whether it's a large claim or small claim, the more money comes back. So the bigger the check will be annually for Vince. So instead of Vince getting $11,000 check or $800,000 check, he gets a 29, because the pool, more members are engaged in containing these costs. And the last point I want to hit here is we are independent. And I said that for a reason in the beginning. So our recommendations are not from a parent. So we're not owned by an Aetna, by a Medical Mutual, by a United Healthcare. When you work with Anthem or MMO or one of those, they're going to recommend a cost containment solution that they own. And so that's not necessarily, you know, it might be a good cost containment solution, but by the way, the money all stays in their pockets, right? So there's a profit attached to those good things. We recommend cost containment solutions, usually with independent vendors that you know are in it to save you money. Sure, they're going to make a little bit of profit, but we are not making recommendations from a parent that's telling us, oh, just recommend one of our subsidiaries to them so the money stays with us. So again, that's very key, is that we're independent and we're making these recommendations that are independent also. Whether you realize it or not, you know, you have an Aetna, which is the network, and then next to them you have, you know, Meritain, which is a third-party administrator, and then you have CVS, which is the pharmacy. So they control all three. Now, if they make a recommendation, they're going to make a recommendation to use one of their companies. Working with Roundstone, working with the CSI team, we may recommend Meritain, but we're also going to recommend an independent too, and let you look at, you know, an alternative solution. So I just wanted to make sure that I close the loop on that, why independence is important. The last piece, that's a great slide there too, is that dashboard. You know, Vince and Vince's advisors have access to this. So just as Vince gets a report, we've tailored this data feed so Vince can go on there if he wants to, or his advisor can go on there if he or she wants to. And it's kind of an executive summary. And the beauty of this thing is it's not written in an insurance. It's insurance-ease. It's written so Vince and Joe Plumber, if you will, or Joe Manufacturer, or Julie Manufacturer understand what is going on with their plan. So the CSI dashboard is always accessible by the employers, by the manufacturers, by the advisors, and then they can customize the way they want it to look or what data they're looking for. So, you know, not only does the team work on their case and make recommendations throughout the year and at renewal, the employer, if they want to look at it too, they have access to it, which is key.
No, that's great. That's great. Thank you so much, Dave. Now, I do have another question for Dave, and that is, you know, my understanding of the captive is that employers that are in around the 30 employee range and up are the ones that really see the most benefit for this type of program. However, Roundstone is able to offer something for an employer that has under 30 employees. Is that correct?
Yeah. So yeah, that's a good question. Whoever asked it, thank you. So Roundstone very recently introduced a program whereby we can offer manufacturers with as few as 5 employees on the plan, up to 20 employees on the plan. We can offer them, it's called level funded. And what level funding does is you basically pay a fixed expense. It looks a lot like fully insured, and you pay it once a month, and whatever's left over, whether it's in your claims fund or that premium account that Vince was talking about, you get it all back. However, the beauty of this program is it's automated. So very shortly, and I don't think it's posted yet, but very soon on Manufacturing Works website, you'll be able to log in and plug in your, you as a manufacturer can plug in your census, and then go to the next page and you can choose from 5 different plan designs, and you can have up to 2 of the 5, and you can send it to our underwriters. So it's fully automated. You get an answer, I believe, within 10 or 15 minutes, whether, you meet the program requirements, and you can get a proposal. So, so for those smaller employers, up until very recently, we didn't have a solution for them. And so now we can go down as few as 5 employees on the plan, as many as 20. It's automated. Once you're Vince's size, 21 and up, you basically would work through your advisor. You work through Oswald and send them the census, and they'd send it to us for underwriting and things like that. So it's a very automated platform. It's a quick answer, and it has all the benefits of our other program, meaning that unused dollars stay in the manufacturer's pocket. Unused premium dollars that the pool doesn't use go back to the manufacturer's pocket. So it has a very high variable cost, and the fact that you get cash back versus get premium credits or administrative credits or what some others do is probably, that's innovative in the industry. So if we're smart like Vince, we should patent it because other level funded programs, you don't get a cash back. You basically get half of the money back, or an administrative credit if you stay. We actually give the cash back to the employers. And so hearing Vince, I think we should patent that.
Yeah. Well, and this is a really good segue, because the next question is Vince, if you could give examples of how the flexibility in plan design and being engaged with your healthcare program has provided additional benefits to your employees.
Well, I think I alluded to one of them before, and that is that if we can assist them in terms of their cost, their out-of-pocket expenses in particular, because they find they find them, to a technique or a service that they have to use, like I alluded to, being the MRI example. I think that's one expense. The other thing too is we've been able to not pass on any of the increases that we have gotten, because we have gotten some increases over the years. Okay. However, the increases have not been significant enough for us to impact. We've been able to not have to pass them on to our employees. So that's been one thing. We haven't had an increase to the employees, I think, is in over the last 6 years. Okay. The other thing too is, from Admiral's standpoint, some numbers were put together. We saved $547,000 some dollars since 2015. Compare that to a fully insured plan. So again, it's these kinds of advantages that we're looking at and or have experienced, and as a result is why we stay with the program. As far as flexibility, the previous, I guess you'd have to look at I guess that would be looking at it from a plan design standpoint. What do we want to cover? And I think the way our program is broken out is we've got let's see, it's if you're an individual, a single person, if you're a couple, if you're a family, there's 4 different groups that I don't have that don't come to mind real quickly for me. But in any event, so there's some flexibility in that regard. And we try very hard to have something that, from a network standpoint, keep the exceptions to a rule. And by that I mean, sometimes you run into a situation where you have to see a certain doctor, okay, or maybe the plan is such that the network is such that you for whatever reason you have to stay within the plan, and okay, that's fine. Conversely, if for whatever reason you don't want to do that, then the plan allows the people to go out and network with it. And so I don't know if that answers your question in terms of flexibility and what it affords the employees, but those kinds of things are available. We try very hard not to. We try hard to not to get along with people and think of what they have to go through when you put these plans together. And conversely, we would hope that the employees understand that we're looking out. It's got to be a win-win situation for the employees as well as for the employer. So that's one of the philosophies that I try to live by. And as opposed to, here's the program, take it or leave it, I don't think that's a good way to manage it. And also, frankly, before I lose the thought, and that is healthcare costs. Today people are sensitive. These are benefits that people look for. And in fact, one of the things I'm sure it comes up in many interviews, if you want to, hire talent and bring good people on, and that is, those questions are asked about, well, what is your healthcare plan? And I think that provides a heck of an incentive for people to take a hard look at where they want to go to work, and frankly, stay employed, because they're good healthcare programs, and it's a big influencer in terms of having people commit to working and staying with the company that they're at, because it has that healthcare coverage. So I don't know if I've answered your question in that regard. In terms, there's a lot of facets to this. I don't want to belabor the point. So.
No, that's great. Thank you so much, Vince. I guess, the other question that we would have then for those that might be interested is, what would be a next step for an employer that wants to find out more information, Dave?
So, you guys, as you mentioned in the beginning, and I don't have the tab memorized, but you could go down to, it's members benefits, member, you're going to be able to click on it, a one-page flyer, and it'll take you to, if you have questions, it'll take you to Oswald, the contact information. If you're between 5 and 20 on the plan, you can enter your information there. But basically, next steps would be, we're coming up on 1/1, and most of the manufacturers or employers in this part of the country renew on 1/1. So if you want to take a look at this and lay it next to your MMO 20% increase, or, oh, we're just kidding, now it's 12. If you want to lay our, this program next to that renewal, reach out to Oswald, go to your website, manufacturing word website, reach out to them, get the census in, and we'll get you a proposal. So when it comes time for your renewal, and you're looking at renewals in late September, early October, you can look at this program and you can see, the projected savings, the ability to save money in the next 12 months or longer, depending on when you renew. Now, if you're a 10/1 or 11/1, or even a 9/1, but 9/1's pushing it, but if you're 10, 11/1 or 12/1, there's plenty of time. Just, go to your site, Rick, and the contact information's there. What they need to do to quote it is all there. And we're very, very, our operations are very efficient. We have 500 or 600 underwriters that do nothing but quote this product all over the country. And our quotes are returned usually within about 48 hours until the end of so October, it gets a little bit busy towards the end. There might be 5 days, but we turn around things quick. Perfect, Rick. Thank you.
I'll give Ann the credit for that one.
And how to access it.
But yes, you can see right from the Manufacturing Works website, there is a link under our affordable health insurance and under the membership area that has a get a quote. and that will get you right to that page that Dave was just referring to. We're just really excited to be able to offer our members yet another benefit of being involved with the company. And if there's a way that we can help the members save money and to keep your employee benefits really stellar for your employees, then it's just a win-win for everybody. We're really excited to offer this program. I will say right now at this point, are there any other questions that anyone in the group has? Feel free to go ahead and type those into the chat box, and we can get these questions addressed for you.
And while that's filling in there, Rick. Again, I can't say enough about think about it. 25 life employer, saving more than $500,000 over 5 or 6 years. Hasn't increased his employee cost to employees in 6 years. He's offering concierge services. I mean, that stuff. Years ago, I worked at a large bank, very large bank that's sold, but that was stuff that only Fortune 500 has. You know what I mean? So you have a 25, employee, members on the plan, and he's being able to offer those kind of the benefits and costs and everything like that. That is a ringing endorsement for this type of program, and what it can do for employers.
No, absolutely. Absolutely. Let's see. I have a question here. It says, what if claims exceed the premiums paid? As a self-funded plan, is the company responsible for excess?
So I'll take that one, Vince. So the way this plan works is, and I'll go back to Vince's example, if that's okay with you, Adam. So if Vince had $1 million claim, okay, what would happen? Vince's company is responsible for the first 20 and it's modern self-funding, whereby there's something called simultaneous reimbursement. So what happens is Vince is going to get talked about, and hey, Vince, on Monday, he's going to get an email from Meritain saying, Vince, there's $1 million claim. You owe us 20. The same time Vince is getting an email, I'm getting an email that says, Roundstone, you owe us the next 980. So years ago, Adam, the small employer would have had to pre-fund that claim and then go to the stop-loss carrier to get it back. That's not the way it works anymore. With a program like this, you're responsible for every individual annually for just $20,000. So first 20, Adam, you pay for it. The next 980, the stop-loss covers, and that's it. So you're off the hook. And so hopefully that large claim, the person recovers. It's a one and done, and that's it. I've had not locally, but in California, I had an architecture firm, 29 employees on the plan. They had $1 million claim. They were not paying, more than a couple $100,000 in stop loss insurance, and they had $1 million claim. It was an unfortunate accident. They got a 4.5% renewal. They've been with us for a while, and they got a 4.5% renewal. Could you imagine if they were fully insured and they had a large claim like that? That Medical Mutual and Anthem, they're not going to get all $1 million in the following year, but you're going to get whacked with a 50%, 60, 70% increase, and they're going to try to get as much of that money from you as they can. The beauty of self-funding is every year it resets. So if that claim was one and done, then you don't have to worry about the premium increases. It's just based on your overall claims below 20. So modern self-funding is worth a look at no matter your size, because we have these mechanisms in there to protect Vince's cash flow, the smaller employers' cash flow.
And the other thing, if I may add to it, Dave, and that is that 20,000 is a negotiable number. If you feel as a company that you want to take it to something larger than that, say 40 or 50,000, that's available. Now, what's the consequences of that? Well, if you push the risk thing more towards the insurance company, obviously it's going to affect your premium. So that's the consequences of that. Depending on where you want to set the number. We set it at 20 grand. We're comfortable with that. We could have set it something lower, but if you set it lower, I guess we set it lower than our it would have impacted our premiums. So we settle on the 20 at this point in time. And that's another thing too. Over the years, as you're going through this, you can review, revisit that particular number if you feel that based on the information that's available to you, that would be to your advantage to maybe up that number or lower it or whatever, because of its impact on either increasing or decreasing your premiums. It's available to you. Correct, Dave? I haven't done that.
No, you're right. You nailed it. It's just the inverse relationship is the more risk Vince takes. So if he goes from 20 to 40, then the less premium the less company takes risk, so the premium goes down. So if Vince wants to take less risk and go from 20 down to 10, then he's more premium because the insurance company's taking more risk. So every year when it's renewal, Vince has the option. Well, you know what, it's running fine, or you know what, I want to take a little more risk to save on my stop loss premiums. Every year he can make that decision. So we'll let an employer go down to as low as $10,000, but generally most are 20 to 25. The average employer, just to give you an idea, that we work with across the United States has 100 employees on the plan, takes the first $35,000 worth of risk. And they all rent, major label networks, Aetna, Cigna, United. So you have access to those networks. You have access to all the hospitals, and things like that. So it's not like to move to this plan. It's like I said, we're getting all these levers to pull. We're not putting you in a little box, and you got to stay in that little box. That's the fully insured world. Our world, it's you got control. You're self-funded. You can do a lot more.
The other thing that if I could add to Dave's comments, and that is the other thing that affects the premiums, frankly, is the demographics of your company. And by that I mean, I'll use Admiral as an example. Our average age here for the 25 people, I think, is about 56 years old. And let's face it, the older that you have, the older demographic that you have in your company, it's going to affect your premiums. Okay, I think Dave, correct me if I'm wrong.
You're right. You're right.
But I think the older you get, the higher those premiums are going to go. Why? Because the underwriters and everyone else involved in the thing, it gets down to statistics and mortality tables and all that other good stuff. And effectively, the older you get, the more possibility presents itself that you're going to have some healthcare costs that are going to present themselves. So that's another factor related to this whole issue. Okay, and the way we figured it, I said, let's see, as I indicated earlier, $20,000 times 25 people, that's a $500,000 hit if in fact that would happen. So you kind of look at it from that standpoint, say, again, as I indicated, is that going to happen? And it's a subjective call based on how objective you can get the data that comes to that conclusion. So that's how we did it anyway. So.
And Rick, I see one last question. I don't know if we've got to wrap up in 3 minutes, but I can handle it pretty quick. Someone asked about company data versus the HIPAA. So as an employer, you have a choice. Vince can get all his data that's HIPAA protected, it's just de-identified, and it's employees 1 through 25. Or, if you want the information, you can have it. So I'm not an ERISA attorney or a HIPAA attorney, but you can have that data, you just can't act on it, But what most employers do is it's de-identified, and so we would come to you and we would say, you have 5 members on the plan, Vince. 8 of them are pre-diabetic. So let's have, let Oswald come in here and do a pre-diabetic or a diabetes education or seminar, a health seminar. To all the employees. We're just not going to pick on these 8 individuals. So the data definitely can be de-identified, and they can get as granular as you want, but you're right, there's a lot of employers that like it de-identified and say, when you address everybody, address everybody the same. So the HIPAA is the third-party administrator definitely work around or meet the requirements that you have.
The way we do it here at Admiral, I get access to all the data, the costs associated with the individual employees. My accounting department gets also information, except it's all numbers. There are no people identified, in the reports that they get. So I'm the only one that can see the reports for everybody. It's another way that we address that HIPAA issue.
Okay, well, thank you. And right now it is 3:59. Unless there are any other questions, we're going to go ahead and take this opportunity now for the next half an hour or so. For those that would like to stick around,